Are we going too far by calling this segment pain in the butt?
No, because it really is such a pain in the butt. And so many people know exactly what you're talking about.
So we're talking about hip pain, but we're only going to talk about one piece of hip pain, but let's just give a general overview. Hip, when a patient comes and tells me they have hip pain, I say where? Because it could be the front, and classically, if it's the front or the groin, it's probably your joint. If they point to a spot on the side, it's more of a tendonitis or a bursitis.
Right.
And if they point to the back, that could be coming from the back, but it also can be what we're going to talk about now, which is piriformis.
The pain in the butt.
The pain in the butt,
Yeah.
which is this tiny little muscle underneath the big muscle here. So it's really important to recognize that might not be that your joint's involved, but it's just this tiny little muscle that needs help. So
if the bigger muscle, the glutes, are weak, that's when the piriformis.
Definitely.
Okay.
Definitely.
Works too much.
Yes, and so it's a really good way to know that you have this problem is if you just you say, where does it hurt? Now, if the person points here, that's something different. That might be your sacral iliac joint. But if they point lower into the butt, right in there, that could be your piriformis. It also can run down your leg. All right, so that's one quick little test to know if there's a problem with it. And Lauren Fishman did a great protocol, which we're going to go over. But before we do that, I want to show you another test that can help see if you have hip or back problems. It's called the sock test. And we're going to go to the worst position, because there actually are four. A therapist will do this with you and look at all and grade you on all the four positions. But if you can't do the last one, you have a problem. So what you need to do is sit at the edge of preferably a treatment table, but you can also sit at the edge of a chair. And what I'm going to have Dana do is try to reach her toe, but she has to put her hands on both sides of her leg. A lot of you are going to cheat and want to do it like this. That's easy. This is much harder. Beautiful. All right, show on the other leg where it might. Okay, if you can't quite get there, or if you only get to here, you got a problem, okay? And it could be your back or your hip. That's called the sock test, and it is a validated test. So again, if you got that point tenderness here, if you try to move the hip and it's limited, you might have piriformis or other types of hip pain. So show us what we can do.
All right, so the first thing, because that piriformis is overworked, it tends to be restricted and really tight. So you can use a handy dandy lacrosse ball, a tennis ball, a little massage ball to do some self-release. Now
Personally, I like the purple lacrosse ball.
The purple lacrosse ball is the way to go. It works the best, absolutely. So you want to find the meaty part of your butt. And you're going to actually lie down and you'll put this right under that part. Now it's important not to be on any bone. So I'm kind of between my sacrum and the hip. And you will know when you hit the spot, because it's gonna hurt. You're gonna feel some tenderness. So don't smush down and make it really uncomfortable, but kind of roll onto it. And when you feel that tender point, I like to just kind of hang out and breathe into it and just think of, visualize your muscle melting over the lacrosse ball. Perfect. And you can gently kind of roll your hips back and forth or roll side to side to get a little oscillation up and down over it. And I like to hang out here until it actually becomes less painful. And then you know you're getting a little bit of muscle release. So then you want to follow it up with a stretch. And I think one of the best ways to stretch this is in the same position. You're going to cross one ankle over the opposite knee. And then you can hold kind of your hand on the inner part of your leg, gently push out. And then if you can grab your ankle and kind of pull it in. So the piriformis is a hip rotator, so you need that little torque to get that muscle stretched. Now it might be a little bit hard to reach your ankle. You can just assist with a towel, and you can just create a longer lever here, and you can just pull in with your hand and push out with your other hand. Now the stretch, again, about a 30-second hold 3 times on this. I think it's a little hard to hold this one a minute, but you can build up to it if you're using your hands. But again, make sure you're trying to relax into it, and you should feel a little bit of a release.
Can I just do a little variation?
You may.
Okay, so some of you might be limited there, but another thing, put this leg straight. And what I do is I tell people to grab here, and then pull the knee to the same shoulder or towards the opposite shoulder. And then torque it just a little bit.
Yeah.
Okay? Again, you have to have that first range to be able to get to here, but it's a really nice stretch that you might really feel where you just use the ball.
Use the ball.
Yeah.
So up, across to the opposite shoulder, and then here, and pull in.
Perfect, perfect.
Yes.
Okay, cool.
So you've got a couple options there to stretch your piriformis. And then the important part you do not want to neglect is training your glutes. So you need to strengthen your glutes because that piriformis is getting overworked because it's doing what the glute should be doing.
Yep, yep.
So we're going to show you a lunge progression. Lunges can be intimidating.
Yep.
They can be hard to do. So I like to use a little bit of support to do it. So you can put 2 chairs. I'm just going to use the table here in the chair. You're going to stand in a staggered stance. Now you're working your front leg. As you do a lunge, you don't want to lean forward or back. Think about keeping your shoulders over your hips and lowering yourself like an elevator and coming back up like an elevator. Use your hands for support, and as you go down, it's just a slow descent without translating your weight to the front of your foot or letting your leg wobble. So your leg should be pretty still. Use those hands again, and you're just gonna lower down.
All the way to
all the way,
yes,
yeah. And then almost.
Most people don't do that.
Yes. So if you're just doing this, you're really not getting a lot of strength in the glutes. So you need to go low.
I was doing it wrong for years.
Yeah, and it's hard, and it makes a big difference
Huge.
when you can really get down nice and low. And then that's why you can use your hands to support.
Right.
Down, kiss that knee on the ground, and come right back up.
Yep.
And again, nice and tall through your upper body. So you're really still here, the legs are doing all the work, and I can feel my glute turning on right away. Start with 2 sets of 8 to each side, build to about 3 sets of 8. This one you don't want to do every day because it is a big muscle. So at least give yourself a day off in between, maybe shoot for about 3 times a week on that. Anything to add?
And then the progression.
Oh yeah, when you can actually
take away a chair.
Do it without holding on. You can do a light hold on one side, or you can just go down without holding on to anything.
You're definitely going to need, if you do 2 chairs, you're going to definitely need something for the second progression.
Yes.
What you're doing looks easy, but it's not.
No, it takes a while to build up
Even
to that.
putting your finger on the wall completely changes it.
Yeah, or holding on to if you have like a PVC pipe or something for a little bit of support. Just a little bit of stabilization.
And no, it may take months before you can do what she just did.
Yeah. Yeah, be patient with it, but stick with it.
Yeah.
It will make a big difference.
Huge.
All right.
Okay. Yeah.
Great.
Thank
Those
you.
are your exercises for aging well.